Hello everyone, I am Dr. Jade Lopez, a proud alumni of AEGDResident class of 2022, as well as Lady of Delta Phi Sigma Sorority Incorporated. My AEGD is with NYU Langone here in the Sunshine State of Florida. So at the end of my D3 year, I knew that I was pretty content with general dentistry and I thought I wanted to transition straight into work. But after I talked with a couple of my mentors as well as completed RAM, I realized that I still had a lot left to learn. So that started my hunt between a GPR versus an AEGD, as well as a program that was going to pay me and not one that I had to pay for. So between the GPR, I knew that was more hospital-based, AEGD was more private practice. GPR had on-call, possible weekends, AEGD didn't have on-call or weekends. GPR had more medically complex patients, a part of a larger medical team, and AEGD had like minimal to moderate. So AEGD kind of ticked off all the lists of things that I wanted to do in residency, so that's kind of what made me look into NYU Langone. Obviously there are some big differences between dental school and residency and how the clinic actually runs. There are two things that I would say that you could do even right now in dental school. The first one would be to develop a routine for every examination that you do, procedures like extractions, fillings, all the things that you do. Having a routine is going to establish ensuring that you are following the protocol that you should be, and to really realize when you need help and when you need to stop. The second thing I would say is maximize your time efficiently. You're not going to have 3 hours to do a filling or do an exam like you do in dental school. I think what I did was start to write down or time exactly how long it took me to get a prep check, how long it took me to anesthetize, how long it took me to get a restoration check, and then talk to my mentors and be like, what's taking me so long and why is it taking me this long? So the only challenge I would say I really faced was allowing myself some grace. You're new, you have all this information from dental school somewhere in your head, and to be vulnerable and actually ask for help. The only other challenge would be completing requirements to actually graduate. Yeah, I feel like the D4s know what I'm talking about. A typical day at my residency program differs pretty greatly from when I first started versus now. When I first started, it was a slow transition into being able to do everything. So mine kind of started off with observations first. Then the next week was, okay, here, try a filling on one of my patients here. Versus today, it's more so arrive early, clock in before 8 o'clock, review the schedule, what patients are mine, and what patients I can help my attending with if maybe her schedule's a little bit overflowing, or because I want to increase my speed, I want to see more patients. If I'm doing a complex treatment that day, we're going to run through the procedures and the steps of a root canal. Continue seeing patients for the morning, write notes simultaneously, 1 hour lunch break, then continue seeing patients in the afternoon, stop at 4 o'clock because from 4 to 5 it's like scheduling to make sure you did catch up with all of your notes. For residency, between that 4 to 5 time would be my daily logger. You have to put in exactly what you're doing every day so that they can keep record of that as well. And then the didactic portion, which I love about this program, is that it's 100% online on your own time. Monthly, we have regional meetings and we discuss treatment plans, like this is what I want to do for my patient, or if I completed a treatment plan, this is exactly what I did for my patient, what they chose, how I explained it. I'll talk about 3 of the most important qualities and skills that I have learned in residency. The first one is efficiency. From the patient seated to the patient leaving, it does not take me that much time. So that's really awesome. The second thing is treatment planning, understanding how to describe things in layman's terms so that they can choose the best treatment for themselves. The other part is treatment planning complex cases. Like, not everything is going to walk through the door cookie cutter, and being able to think quickly on your feet what's going to benefit them. Then the third thing would be the leader and a team player. I would say that as a dentist, sometimes you think that, oh, like, I'm the big guy, you have to do exactly what I say, and that's not necessarily it. The people in your auxiliary really make your team and make your clinic. So the more that you are on the same page with them, the more that you respect them and communicate with them and have compassion with them, is the better that your team is going to be. So